Hi, my name is Rebecca, and I'm a young adult breast cancer survivor. I was diagnosed with breast cancer at the age of 29. It was somewhat of a surprise. I felt a lump in my breast, but kind of, I guess, hoped that it wasn't what I thought it was. I have a very, very long history of cancer in my family, so it almost seemed inevitable. And when I finally decided to go in for testing, I got a little bit of pushback. Of course, due to my age, it was perceived that it was just a cyst and that people my age don't get cancer, which we know is not the case. And thankfully, I still got referred for a mammogram. I'd say a couple of weeks from that encounter, I met with the radiologist. They gave me an unofficial diagnosis. And then the following week, I was back in with my women's health physician, and she gave me an official diagnosis of invasive ductal carcinoma, which is breast cancer. It was caught at stage 2, so it was still very early and very treatable. And I went on with 6 months of chemotherapy and immunotherapy for a full year. And so that was my course of treatment. I also opted to get a double mastectomy. I just wanted to eliminate any kind of risk of a recurrence. And along the way, I actually had quite a bit of a journey. I had a lot of infection. I had a lot of strange symptoms that were not really well managed at the beginning, and it was a really difficult 6 months of my life that actually unfolded to several years of unmanaged symptoms and pain and challenges. So I absolutely believe it when they say that once you're out of treatment, that's not when it ends. It certainly is a different path for everybody, but I would say that that was just the beginning of what I would learn would be, managing my health and kind of knowing what life was after cancer. Um, because a series of health things occurred after my initial treatment. So I initially learned about palliative care through my first oncologist. I will say that I've had about six in total oncologists, and there is reasons for that. But I learned from my initial oncologist about palliative care when I had many complications with my chemotherapy regimen. My first two chemotherapy cycles landed me in the hospital. They were a little unsure of what was really happening to me. They told me that very strong symptoms are pretty common with chemotherapy, and I was just very sensitive to medication. But I was really kind of challenging that norm because I thought, there's several people that can manage chemo and it's not keeping them in the hospital for 10 plus days. So I had a conversation with my oncologist to say, like, what are my options? Is it removing can they not continue chemotherapy? What are our next steps? What ended up happening is they did eliminate one drug from my chemotherapy regimen because it was very strong for me, and so they think that they might have still had some success without it. But they also brought up palliative care. Well, what I will say is there was a lot of kind of misconception around it. It was introduced to me as a we might need this, but we don't want to go there kind of thing. And I found that interesting because at the time, as a patient new to this landscape, it sounded like hospice care. And so that scared me. And I thought, is this happening because I got a drug eliminated and this is not going to end well? But it wasn't the case, thankfully. I will say that that initial oncologist, we didn't really get to explore that option, which is unfortunate. Because I think even at that center, there was still a lot of strange dialogue around palliative care and what it was and what it wasn't. Thankfully, I transferred my care and I had a much better experience with palliative care approach, discussion, education, and then the actual palliative care doctor itself. And what that looked like was the oncologist sat me down and said, there's a lot of misconceptions about palliative care because I think they kind of read it on my face, like, oh, we're talking about it again. And they said palliative care is to help you with, symptom management. It can help you with psychological issues, spiritual issues, things like pain, fatigue, breathing issues. I mean, you name it. It's kind of just their second line of defense, and they all work together. And so being informed in that way, it didn't sound as intimidating for sure. And it helped me realize and know that, okay, this is just an alternative approach to helping me get through all of these things. And so when I met with the palliative care doctor, he was so amazingly wonderful. He said, what's been going on? What's happening? And I explained, the challenges I had through chemotherapy, how I was still really, really suffering from pain and fatigue. And he, designed a care plan for me. And it was nice because, as somebody that is very, very sensitive to medications, it was a different approach that was, tailored to me. And it helped me manage these symptoms in a way that I had not been able to manage before. I was very frustrated because I thought, I'm weak. I'm going to suffer through all this the rest of my life. And, it's not going to be a great quality of life. And this palliative care physician got me to a place where I didn't feel miserable every single day. And so meeting him and having these interventions was, a lifesaver because, as I mentioned, it was really great to not be in treatment and get past my surgeries, but I was still really dealing with these lasting effects of cancer and I didn't know where to go. And palliative care absolutely took care of that for me. My advice for palliative care and how to have those discussions and get patients in the door and having these conversations is ask questions. Absolutely ask questions. I think that especially when dealing with something like chemotherapy, and that's not the only treatment we know for cancer, but it can be one of the roughest. And I think there's a perception of chemotherapy that it's just awful and you have to deal with it. But palliative care can make it manageable. And so, if there are areas of treatment, whether that's chemo, radiation, surgery, what have you, immunotherapy, if there are areas of treatment that are just seeming way too challenging to maintain a quality of life, have those conversations, ask those questions, and say, what can I do differently? Is there a palliative care approach that I can take? Is there a palliative care physician or team that I can meet with to help me manage these symptoms? Because they are, my quality of life is suffering. I'm feeling a bit challenged, and I want to know what other options there are for me. And I think that getting those conversations started are really important, especially given that, my first encounter with palliative care was not that positive. And so if maybe the first conversation does not go that well, then seeing what other conversations can look like down the road, if there's an alternative center that might be able to offer that option, or a different physician that might be more supportive of a palliative care route, um, start those conversations, because I didn't get introduced to palliative care until a couple years after my initial experience. And I think it could have saved me a lot of money and heartache and, symptoms in my life and lack of quality of life. So have those conversations early and often.